We're going to finish Chapter 16 by looking at healthcare-associated infections and emerging infectious diseases. Nosocomial infections, or healthcare-associated infections, are infections that patients acquire while they're in a healthcare facility. About 5 to 15% of all hospitalized patients acquire a nosocomial infection. The big problem with nosocomial infections is antibiotic resistance. Because if you think about where these microorganisms are living in the hospital, they've already been in other patients, been exposed to antibiotics, and then maybe they've been out in the environment and they've been exposed to disinfectants there. And then they get into the next patient and they're going to be hard to treat. There are 3 factors that cause nosocomial infections. So the first one is the microorganisms that are living in the hospital. So they're going to be pretty resistant to a lot of our antibiotics and other medications. And the second is the hospitalized patient themselves. They're usually compromised. So they're in the hospital for some other reason, they're sick with something else, and then they get this nosocomial infection on top of that, and they're probably not in the best shape with their immune system to fight off the microorganism. And then the third thing is we have our chain of transmission. So maybe the microorganism is being transmitted between patients by maybe direct contact, maybe somebody didn't wash their hands, or maybe it's being transmitted by a fomite. For example, maybe the stethoscope didn't get disinfected in between patients, or maybe it's through a vehicle, like maybe it's airborne. So that could be another route of transmission. The most common sites for nosocomial infections, if you look at this pie graph over here, you can see that surgical site infections and lower respiratory infections are the most common. It makes sense that a surgery site would get infected because you've got a break in the skin. And so that's an easy route for microorganisms to get inside. And then lower respiratory infections, a lot of those are going to be patients on ventilators. Oftentimes they get pneumonia. And then the third one would be GI infections. So we think about things like C. diff. If you're interested, this link is very interesting. It shows the healthcare-associated infections in different Utah hospitals. And so you can look up a particular hospital, maybe you're going to have knee surgery, you can actually look up that hospital and see what their rate of nosocomial infections are. So some of that, I look at that and I'm like, I would not go to that hospital. So it is a good thing to check. And these are just some of the microorganisms involved in healthcare-associated infections. So you don't need to memorize these, but a lot of these we've talked about before, and a lot of them are antibiotic resistant. Nosocomial infections have a high cost. You don't need to memorize any of these numbers, but they will prolong hospital stays by 4 to 13 days. And if you're staying in the hospital longer, that will increase your bill. And we do end up losing about 20 to 60,000 patients from nosocomial infections per year, which is quite a few. So we really want to prevent nosocomial infections from occurring in the first place. So they really stress proper training and infectious control measures in hospitals, making sure everyone's washing their hands after each patient, making sure you have a correct aseptic technique. And a lot of hospitals will have an infectious control nurse. So this nurse will be responsible for monitoring the nosocomial infections that are occurring in the hospital and keeping track of those and then reporting those. And then lastly, we have emerging infectious diseases. So these are diseases that are becoming more of a problem. They could be new infectious diseases we haven't seen before, like what's going on right now with the coronavirus. And some of them are old diseases that we thought we pretty much don't see anymore, but now they're re-emerging and coming back. So measles would be a good example there. And let's take a look at the death rate from infectious diseases in the U.S. So here's the infectious disease mortality rate in the US, and you can see that around the turn of the century it was pretty high. And then you can see this big spike with the 1918 Spanish flu epidemic that killed a lot of people. But as public health measures got better and we got vaccines and antibiotics and clean water, clean food, you can see the deaths from infectious diseases really went down. They did start going up again in the early 80s, and that's because that's when we first started seeing HIV. And so a lot of those patients with AIDS would get all these opportunistic infections and die from that. Here's just a list of some emerging infectious diseases. You can read through that. You don't need to memorize them. There's many reasons for increases in the emerging infectious diseases that we're seeing. So make sure on the exam you're able to tell me two of these. So the first one is world population growth. So there's a lot more humans on the planet now, so there's a lot more people that are able to be infected. Increased international travel. It's a lot easier to travel to different countries now. You can jump on a plane and be in Europe in 8 or 10 hours, whereas before you had to take a boat to get there. And when you were traveling by boat, it usually took about a month to get there. So you'd either be recovered by then, no longer infectious, or you'd be dead, and so you wouldn't spread it. But traveling by plane, you get there in 8 hours and you're still going to be infectious and spread the disease. With more people on the planet, we've have a lot more habitat disruption, so people are moving into areas they haven't lived before, cutting down forests, being exposed to the wildlife there, and so we're increasing our exposure to zoonotic diseases. Microbial evolution, our bacteria are developing an antibiotic resistance, and so it's much harder to treat people and get rid of those. And then inadequate public infrastructure can be a problem, especially in developing countries. Maybe they don't have very many hospitals or doctors to treat people, or maybe they don't have a clean water supply, so that could spread disease. Climate change, we're seeing vector-borne diseases moving further north than they've been before. Because the climate is warming and the mosquitoes are able to live further north than they have been before. Social unrest, wars, we saw in Yemen where they're having a civil war, the largest outbreak of cholera that we've ever seen. So millions and millions of people were infected. Bioterrorism, people do weird things like send anthrax through the mail. So that was back in 2001 they did that. Changes in food processing and agricultural practices. So it used to be that you would get your food locally, but now a lot of the food processing is centralized. And so if you go pick up some hamburger at the grocery store, there's a good chance that that probably was not processed here in Utah, and maybe that's coming, you know, from another state, and maybe it's several cows from several states, and so it's hard to trace back where the infection came from. Changes in human behavior, probably the biggest one is we're more sexually promiscuous than we have been in the past, I think, and that's spreading a lot more STDs. And then medical advances, so like organ transplants, chemotherapy. We're getting more people that are immunosuppressed than in the past, and they're more likely to get infections. And then who's monitoring and responding to these emerging diseases? So this would be your county and state health department, which report things to the CDC, and then the CDC will report data to the World Health Organization or the WHO.